Hello and welcome to the Food and Research Action Center webinar, Leveraging Nutrition Programs in Disasters webinar. At this point, I'd like to turn the floor over to our moderators, Ellen Vollinger, FRAC Legal Food Stamp Director, and Meg Buckley, FRAC Congressional Hunger Center Emerson Hunger Fellow. Ellen and Meg, when you're ready, the floor is all yours.
Thank you so much. This is Ellen, and I want to thank everyone and welcome you to this webinar. We appreciate your taking the time to visit with us and learn lessons from the recent round of disasters from 2017 and 2018. And I want to give a special thanks to Meg Buckley. She's FRAC's Congressional Hunger Center Emerson Hunger Fellow. She has updated FRAC's resources with respect to this topic and organized and will be moderating today's session. So I will turn it over to Meg, but again, thank her so much for her leadership on this issue.
All right, thank you, Ellen. So as she said, I am an Emerson National Hunger Fellow currently working with FRAC. So just a quick overview of today's webinar. I'm going to be reviewing the SNAP, DSTAP, and other nutrition program resources and how they can be leveraged in disasters. And then I will briefly touch on Puerto Rico disaster response from 2017. Then we will go into lessons learned from Hurricane Harvey with Celia Cole from Feeding Texas, lessons learned from the California wildfires with Stephanie Nishow, and then the use of phone calls to qualify for DSNAP with Cindy Huddleston. So the Supplemental Nutrition Assistance Program, SNAP, and other federal nutrition program resources can be leveraged to help individuals and communities recover from natural or man-made disasters. As Ellen said, FRAC has two main resources as far as using DSNAP goes. The Advocate's Guide to Disaster SNAP, which has been recently updated to include lessons learned from the 2017 disasters, as well as our best practices for getting SNAP to disaster victims, which can be accessed below. So SNAP is America's largest anti-hunger program, and it's funded through USDA's Food and Nutrition Service, FNS, but it is administered through state agencies. One of the important things about SNAP is that it is highly responsive to the highs and lows of the economies, so it can expand and contract to different needs from recessions, natural disasters, or individual misfortunes. So for every $1 of SNAP generates $1.79 in economic activity. So SNAP is not only very important for ensuring food security, but it is also important to local economies as well. The SNAP can be used in response to disasters to help. So individual households may request replacement benefits on an individual basis for misfortunes. States also have the authority to issue replacement benefits for ongoing SNAP households in zip codes with areas for power outages. This is known as mass automatic replacement. States may also request authority to issue supplemental benefits to bring SNAP benefits to the maximum amounts per household size. So disaster SNAP, which I will refer to as DSNAP, is a primary disaster nutrition relief program, and this is separate from SNAP. It can be run after a presidential authorization of individual assistance, and it is available only if the state requests authority to run a DSNAP program from USDA. And it operates under streamlined procedures. The participants may deduct disaster-related expenses from damage or food loss from their eligible income. Because of this, many households not typically eligible for SNAP benefits may become eligible due to loss of food or damage to their homes. Therefore, it's important for advocates to connect disaster victims with resources so that they may know that they may be eligible for DSNAP. So child nutrition and other programs can also be tapped to serve disaster victims, such as WIC, the Child and Adult Care Food Program, summer nutrition programs, school meal programs, and commodity distributions. Recommendations for all of these are outlined in FRAC's Advocate's Guide to DSNAP that was referenced before. We'd like to especially touch on using WIC in disasters. So although WIC is not a disaster program, it is essential to support pregnant women, infants, young children, and new mothers in times after disaster. So states can employ alternative procedures to continue WIC after a disaster. These include modifying the WIC food package components to accommodate disaster conditions, as certain foods may not be available after a disaster, replacing lost or unredeemed WIC food vouchers, establishing WIC clinics or utilizing mobile equipment, expanding eligibility by allowing disaster families to qualify for WIC by signing a self-declaration form rather than demonstrating that they are income eligible, by simplifying or expanding eligibility procedures, shortening or lengthening WIC eligibility certification periods, and continuing to modify nutrition education requirements. Child nutrition programs can also be leveraged in disasters. For example, if a household with a child receives DSNAP or is certified as homeless, the children are eligible for free school meals for the remainder of the school year and up to 30 days for the following school year. This is essential to ensure that children receive adequate nutrition in the wake of a disaster. USDA can also waive certain child nutrition program rules, such as meal pattern requirements, as certain foods may be unavailable after disasters. USDA encourages state nutrition agencies to prepare and plan ahead before a disaster strikes so that the response can be as swift as possible. And we would like to briefly touch on the Puerto Rico disaster response. So Puerto Rico's Nutrition Assistance Program, NAP, is structured differently than SNAP. Unlike SNAP, NAP is a capped block grant with a set amount of funding annually that cannot expand to meet an increased need, whether due to a disaster or economic downturn. DSNAP is also not available for Puerto Rico storm victims. However, they received waivers to use NAP benefits for hot prepared meals, flexibilities for WIC participants and school meals, and disaster household distribution for food boxes to approximately 500,000 households. Evacuee NAP participants could also receive SNAP benefits for up to 2 months. More of this is outlined in our FRAC's Advocates Guide as well. So we are going to move on to Stephanie.
Hi there. First, thank you, Ellen and Meg, for hosting this webinar. I'm really excited to hear the fellow presenters' recommendations and their presentations as well. So in last year, California implemented disaster SNAP twice, and CASB, my organization, led the outreach effort to get the word out to people who lived and worked in the disaster areas. So in October, there were wildfires in Northern California, and we had DSNAP in 7 counties. And then in December, there were wildfires down in Southern California that didn't trigger the DSNAP, but then in January, it rained and there were mudslides. So the wildfires and the mudslides together did trigger DSNAP, and we implemented in February. Our implementations were quite different. In Sonoma County, which was in Northern California, we already had SNAP outreach partners there with Redwood Empire Food Bank and Catholic Charities. So we partnered with them as well as the state and recruited, trained, and coordinated 50 partners to come in from neighboring counties to do outreach. Our priority was to reach as many people as possible through flyering and paper applications, and just trying to talk to as many people as we could. We made sure all of our outreach workers had not only the materials that they would need, but talking points, because we had a few people who went on the radio. And then another role that we took on was coordinating where in the county people would go to make sure that we got the most reach. Additionally, we were trying to reach out to intermediaries like employers and disaster responders and school districts. And just in general, trying to get people to help us raise awareness of this program, because as you likely know, DSNAP is only available to people who are not typically eligible for SNAP. So it's a different challenge. But then in Ventura County, we had fewer partners. So Ventura County didn't have any DSNAP didn't have any outreach providers. So we were partnering more closely with the county as well as the state, and we were only able to recruit a few people to go and do outreach in the county, and so we focused on very localized and very targeted in-person outreach. And then we were doing a lot of remote support and calling chambers of commerce, major employers, school districts again, and then just utilizing a different model where we had people on the ground who would send us back in the office leads, and then we would be able to follow up on those. In both cases, we were providing translations and doing outreach in English and Spanish, and that proved to be an important aspect of the outreach. So mostly I'm focusing my time on our lessons learned. So the first one is, of course, plan ahead, which seems like it should be kind of obvious, but to break this down a little more specifically, there are conversations to have ahead of time. Specifically with your state, it's important, if you're going to be leading the outreach effort, to be on the same page in terms of who does what. You don't want to be in a situation where you're wondering, am I bringing the flyers or are you sending the flyers? So making sure that everybody's clear on whose role is what is really important. In addition, we learned that, we're encouraging our state to solidify their relationships with big organizations that have a lot of impact, like emergency services and health and education, so that when a disaster hits and we're implementing DSNAP, they already know who to go to, and these are folks who can get the word out through their networks easily and quickly. When we were doing outreach, we found that in terms of emergency service providers like Red Cross or FEMA, we were often introducing DSNAP to those workers, and it was, we think it would be more effective for the information about DSNAP to come through their regular channels, because while the person who was working, at the tent at that moment may have been really interested, that when the shifts changed, we were having to re-educate people again and again. So again, just having these relationships already would be really key. And then another plan in terms of planning ahead, to really think about your outreach related communications, and get ready ahead of time the things that you can, like a template for a flyer, for talking points, for a next step flyer to give to people to apply, an easy URL. Our state did a great job of putting up a lot of information about DSNAP, but the URL was really clunky, and so it was hard to tell people, and it didn't really stick with people, and if you were trying to type it into a phone, it was just not as easy as it could be. But they're looking into an easier one for next time, which we're excited about. In addition, it's important when you're thinking about your outreach-related communications to have already worked with your state and county to have thought about extended hours and when they are, so that they could be publicized. We've had county offices be open on the weekend, but because they're not typically open on the weekend or have extended hours, people didn't know about it. And if those changed after we did outreach in that area, or after a bunch of flyers got posted, then it was hard people didn't think that they were going to be there. So the weekend hours weren't as utilized as they could have been. And in some cases, people were still working, and so the weekend was when they had time to go, and so it was a missed opportunity. But if you can find out about extended hours early and publicize those early, that is key. And then also translations, pulling out translations as a separate plan ahead item. Because if you're doing outreach in other languages and you are doing media in other languages, then it's follows, that you're going to get people who speak those languages, and while your county or your state may have adequate language coverage for their caseload, it may not be enough to cover additional folks in those languages. So we found that our outreach workers have been particularly useful, not only in the field, but in helping with translation. And so that's something to just plan on, as an outreach provider, plan on working with your county on to see if you might be able to help with translation. And then, of course, there are timeline considerations. So we found that the county and the state were often thinking that the first day of DSNAP implementation, they were going to be hit with a bunch of people. But what we found is that it ramps up, and it takes a while for word of mouth to spread. So it's really the end of this implementation when the lines start forming and the offices are really busy and they need a lot of translation help, because it takes, so in both cases we had 7 or 8 day implementations, and in both cases it was toward day like 5-ish that everything got super, super busy. So as you're planning like your outreach staffing and where you're going to send people, just think about having a crush toward the end of the period. And then again, when you're working with your state ahead of time, really encourage them, if they're going to have extended hours or weekend hours, to plan those toward the end, because that's when most of the people will be there. Again, on the translation help, I keep talking about translation help because I think that it's a spot where in our 3 last implementations we've needed more translation help. And so just really keep that in mind. And then lastly, this on the plan ahead, we've got this picture of the cover of an advocacy timeline that my colleagues here at CAFB put together. And it walks you through the things to think about ahead of time, the during, and then after. And it's a great little checklist to help maximize food assistance. And I believe it's going to be part of the updated resource guide from FRAC. So those were all the plan ahead things. I'd also encourage you and your state to work toward a regional response. On the outreach end, it's important because, obviously it would bring more people into the area to help get the word out. But then also it allows the people who live there to have a break and know that their community is still being looked after, still being cared for. By the time in Sonoma, by the time DSNAP was implemented, our colleagues had been working for 3 weeks straight, and so they're trying to serve their communities. So we were able to come in and just let everybody have a day off, which was really helpful for them. It also helps build regional expertise and capacity so that if it happens again, we have more people who are able to do DSNAP outreach and who know the program better. And then just a quick reminder is that your county workers or your state workers who live in the area were also impacted. They may not have personally been impacted, but they likely know somebody who was as well. And so when you're planning the response on who's going to staff at the county, if we're encouraging the state to think regionally as well, to bring in not only more workers to handle additional caseload, but to help their colleagues who are impacted, just help in general, help their colleagues who are impacted. We also found that working with local experts was really important to help us target where to go. So instead of just kind of going blindly out into the community, we knew where to go and what to look for, or who and where to look for folks. So I can't emphasize enough how important it is to have somebody who knows the community. And then, as I mentioned when I was talking about outreach on the previous slide, combining on-the-ground outreach with remote support was really successful for us. And as if we have to do this again, we'll be combining both of the models. So it's important to get the word out to a lot of people, but then also we found that there was a lot that more than we realized could be done from the office, and that also expands our pool of people who can help with the response, because we had several people who weren't able to deploy to the counties that were impacted but wanted to help. And although it would require a different kind of coordination, we think next time we will be able to run both an on-the-ground operation and a remote operation to help get the word out. And then lastly, I don't have it on the slide, but it's important to really think about self-care and have a plan in place for outreach workers. Ordinarily, outreach is stressful in that you're often meeting people in crisis, but with DSNAP outreach, it's compounded. And you're in an area that has been devastated, and you're hearing a lot of stories that are often heartbreaking. And so just having a plan for making sure that everybody has thought about how they can take care of themselves throughout the day is really important. Because the days are long and they're hard, and it's easy to get burnt out, even though the window is relatively short. When people go back to their own communities, we want them to be able to re-engage with their usual work, and so it really would emphasize a self-care plan. And that's it. So this is my contact information. If you have any questions, we're doing Q&A at the end, as Courtney mentioned, and I'll be happy to address them.
Okay, I think we're going to go ahead and let Cindy go next.
Thank you. I'm Cindy Huddleston from Florida Legal Services, and I'm here to talk about Florida's experience with the DSNAP program after Hurricane Irma last year. But I'd be remiss not to put the Irma DSNAP program in context. Hurricane Irma had an almost unprecedented wind field with hurricane force winds that spanned out to something like 80 miles. Irma damaged areas from the Florida Keys to the Panhandle, and when it was all over, 48 of Florida's 67 counties were approved by FNS for DSNAP, which we call Food for Florida in Florida, and millions of Floridians became potentially eligible. The way that the DSNAP program worked in Florida was that the state opened Food for Florida brick and mortar locations in affected counties, and it allowed families to go in person to apply on a particular day based on the first letter of their last name. Folks had to go in person for an interview or send an authorized representative in their place. Because of the magnitude of the storm, Florida activated and strongly recommended that folks pre-register for DSNAP online. In pre-registration, persons were asked for information that's relevant to their DSNAP eligibility in advance of an in-person interview. But pre-registration was not a requirement. You didn't have to pre-register. It wasn't a prerequisite. And it was not, even if you did it, in and of itself a DSNAP application. Instead, it was really just a way to expedite Florida's response to what was a massive need for services, and a way for the state to pre-verify identity. But even persons who had not pre-registered could still show up at a DSNAP site and finish the application process. As much sense as it made to pre-register, some folks faced insurmountable challenges to being able to pre-register. Some people didn't have access to a computer. Some were unable to use a computer because they aren't computer literate. Some persons have a disability that makes use of a computer difficult. On many occasions, the pre-registration website crashed. And last but not least, to complete pre-registration, you had to have a Florida ID or a Florida driver's license, which many people did not have. And even some of those who did have them were told by the computer that their ID or license number was invalid. And of course, the requirement for in-person interviews presented its own host of challenges for many applicants, particularly those who have a disability and couldn't go in person to an application site because of the nature of their disability. Although FNS says in its DSNAP guide for states that states can consider several options to make the in-person interview easier, such as using an authorized representative, setting up application sites that are near to vulnerable populations, offering special transportation, and even Skype, FNS has never allowed states to use a telephone interview for DSNAP, which is unusual for a modernized state like Florida, where the majority of its millions of regular SNAP applicants are interviewed over the phone. Although FNS gave Florida all these lovely options, Skype, transportation services, and the like, the only accommodation that Florida offered was the use of authorized representatives, who, by the way, if a person could even find an authorized representative, had to be intimately familiar with the household and assume liability for false or incorrect information. The end result was a program with problems: the restricted pre-registration, the in-person interview requirement, the limited opening of application sites. All this contributed to what was mass chaos, with lines as long as 50,000 people or more, and repeated instances of law enforcement officials closing down Food for Florida application sites early for safety concerns. This, as you might imagine, made it impossible for persons with disabilities who could not travel to or stand in line in an application site to participate in Florida's IRMA DSNAP program. And these are the images that I want you to see to give you an idea of what applicants faced, all in the sweltering Florida heat and sometimes rain. And as you can see, there were many occasions when law enforcement just closed down the site completely because of the overwhelming response and the inability to do crowd control. We were contacted by persons whose disabilities prevented them from traveling to a DSNAP site or waiting for hours to be interviewed in line at one, and who didn't have anyone willing to endure the application site for them as an authorized representative. Because these folks were effectively precluded from participating in the DSNAP program, on their behalf, Florida Legal Services, along with the University of Miami Health Law Clinic and the Community Justice Project, filed a lawsuit in federal court in Miami asking for an accommodation for the in-person interview. Because of the lawsuit, USDA, for the first time ever anywhere, allowed a state to conduct phone interviews of persons who were unable to go in person to a DSNAP site due to their disability. We were very pleased about this. The phone interviews that the state ended up conducting happened in two distinct phases. For persons who had pre-registered, for persons who had the documentation and the computer literacy and the access to the computer to be able to pre-register, they were able to apply by phone in December. For persons who had tried but could not successfully pre-register, for example, someone who didn't have a Florida ID, they were allowed to do phone interviews in mid-2018. The phone interview was a very big deal, especially for states like Florida, where the challenges facing applicants and the sheer magnitude and scope of the program made all the other alternatives FNS has sanctioned, even if Florida had employed those, made those ineffective. And the bottom line is that because FNS approved use of phone interviews for IRMA, more than 4,500 persons with disabilities were able to obtain disaster SNAP, which resulted in over $3 million more dollars in DSNAP going to affected persons and being spent in their communities. All disasters are different, and all states have different capabilities. But you never know when the big one, whether that's a mudslide, tornado, hurricane, wildfire, earthquake or lava. You never know when that's going to hit. And when a disaster is as widespread as Irma, business as usual with folks lining up in mass at location sites probably isn't going to be feasible. It wasn't in Florida. Does this mean that FNS or your state will automatically put telephone interviews on the table in the future? I don't think so, but it is precedent, and now may be the time to talk to your state agency, your lawmakers, about ways to avoid what happened in Florida from happening in your state. Waiting until the disaster happens may be too late. So I'll be the first to say that, here's to a disaster-free 2018. But if one does hit your state, I'll be happy to provide any information I can to you about our experience and the journey that we took from mandatory in-person interviews to telephone interviews, which was really the only accommodation that would work for many persons with disabilities in Florida and Irma. Thank you.
Great. Thanks, Cindy. And actually, while we're waiting for Celia, we can take some questions that we've already received. So this one is coming from Gary Slate. What are the best ways to communicate DSNAP benefit programs to very rural areas after a disaster has occurred? I'm not sure, maybe Stephanie, if you want to take this, since you touched on communication after a disaster.
Sure. So that is a really good question. We have we've sent people out to try to talk to as many people as possible and to find community areas where people might be and to ask people to post on social media. One of the things that we found out through just talking with people was that many people found out about DSNAP because somebody talked to them and then somebody else put it on their Facebook page, or it showed up on one of the disaster pages that they were following on Facebook. So I think social media is a good option, and if there are already disaster providers that are in touch with folks, that's a good option. And then media. So in Northern California, some of the areas that were hit were in the Bay Area media market, which includes San Francisco, and so it's an expensive media market, and there's a lot going on. So TV wasn't a good fit necessarily, but there were radio stations that people listened to, and even public access that people listened to, and Spanish language radio, and we had pretty good coverage there, as well as just the local newspapers. We had people who would bring in, cut out the article in their local newspaper and bring in the clipping with them. So I don't have a good formula for you, but those are things that worked for us.
Great. And as far as, are there training requirements for persons that want to help volunteer with DSNAP benefit assistance? I don't know if Stephanie or maybe Cindy.
This is Cindy. I'm not aware. Go ahead, Stephanie.
It's all right. Go ahead.
I was going to say I'm not aware of any in Florida, but I think the place would be to start with your state agency. If you're talking about people who want to volunteer to help out the state agency, that's one thing. If you're talking about volunteers who may want to help nonprofits get the word out, that would be something different. So I think it's going to depend on who you're trying to volunteer with and what what requirements that agency or different organization might have. But I will say that volunteers are much needed and encouraged.
And I would agree with Cindy. I think it depends on who is running the outreach campaign. The way that we structured it was because we were getting different people every day from different outreach organizations. We did, and everybody, so the people who came already knew CalFresh, or in our state, SNAP is called CalFresh. People already knew CalFresh, and we were just layering on top DSNAP. And so people could answer a lot of questions when they were out in the community because they already knew the program. and they were accustomed to going out and talking to people about CalFresh already. But anyway, we did a training in the morning and got people comfortable talking about CalFresh or Disaster CalFresh and talking about practicing their messaging and addressing potential concerns that would come up. And then we would deploy people out to different areas of the community with their knowledge. But I think it just really depends on how your state sets up your outreach program. Our state did a training on DSNAP. They made a training available to everybody. But then, like, the in-person practice part is something that we did.
Great, thanks. And Stephanie, we actually have another one for you. You touched on the partnerships with Red Cross and FEMA as far as DSNAP. Do you have any recommendations for streamlining the information that they receive?
That's a good question. I just think that it would be helpful if it was, if it came down through their regular channels. I mean, I don't know that it's more specifically what is being asked, but I think the important part is that it's part of their regular training and it's part of, like, something that everybody who works in their response units knows about and can tell the people that they're working with about. I'm not sure that that really answers the question quite well, but like in California, we have an Office of Emergency Services, and so our state is working on coordinating better with that state office. So when there is an implementation, they're already in communication.
Great, thank you. And this one can either be taken by Cindy or Stephanie, but we've gotten a couple questions as far as how other states have experienced the type of barriers that Florida experienced after Irma in individuals with disabilities obtaining DSNAP and being able to go through the arduous process.
Yeah, this is Cindy. It's my understanding that this is a common problem among states, and that finally USDA, for the first time, agreeing to have phone interviews was something that has been seen as significant. Now, I don't want to speak for other folks that are on the line, but I do believe that California has been trying to do some advocacy now to talk about phone interviews and other ways of doing interviews besides in person. So I do believe it's been a universal problem. I think the difference with Irma was that it was just so widespread and there were so many people affected that it really went to the forefront.
So the ruling on your lawsuit happened pretty right before we ended up implementing in October, and we tried to get phone interviews and we weren't successful. But you're right, there is advocacy happening to try to plant ahead to see if we can't get them in the future, because the same barriers exist in the communities that we were seeing as well.
So we're going to take one last question. So this one is from David Devon. After disaster, and this can be fielded by either Cindy or Stephanie, but after disaster, when distribution channels are cut off and retail store staff are part of the affected community, where are recommendations where participants can use DSNAP?
So DSNAP usually isn't authorized until the retail sector is back up. Is that the question?
Yeah, I think that answers it. Okay, well, Celia has outlined her slides as far as recommendations for rolling out DSNAP and disaster relief in the wake of Hurricane Harvey. Celia, are you there?
I am. So I'm going to, just a couple of caveats before I start with our policies related to DSNAP. The first is that we believe that all the things that we're going to talk about next and recommend are allowable, but we are still working to figure out whether the recommendations involve administrative versus legislative advocacy. And so I apologize if something sounds like a really great idea and then you turn around and try to do it and realize it's not legal. But anyway, we think these are good recommendations, even if they're not entirely allowable currently. And then the second caveat is just that, I represent Feeding Texas, which represents all the food banks in Texas. We have a special relationship with the state when it comes to doing these regular SNAP enrollment. And so some of our recommendations are really more relevant to the role that food banks can play with DSNAP. And so if, for those of you who don't have a food bank network, that you're working with, I apologize if these recommendations aren't as relevant for you. So anyway, that said, I'll jump right in. So one of our first policy obviously relates to pre-registration, and I think previous speakers have already talked about this, but definitely feel like this would significantly reduce waiting times for people, particularly when you're doing in-person registration, which is what Texas relied exclusively on following Harvey. And then obviously having an application period for DSNAP that is sufficient to allow all the people who have evacuated and once they're able to come back into the area that was hit, to give them enough time to get enrolled in DSNAP is really important. After Hurricane Harvey, they initially set the application period for 7 days, and that combined with the high demand created, significant delays. So certainly having at least a 30-day application period, we think is imperative. I will move on right now to the next slide to recommendation number 3. We really struggled, particularly in the Houston area, which is, for those of you that don't know, Texas, an enormous metropolitan area, and the one that was one of the hardest hit areas following Harvey, and one of the ones that I think was the latest in terms of entering the recovery phase, which is when obviously DSNAP can become available. And so figuring out how to deal with just the massive number of applicants in that area was really difficult. And that's really where we saw the process break down in Texas, with just incredible lines and problems. And so we feel like that one of the best recommendations moving forward, and particularly for large metropolitan areas, is that MOUs with local sites are developed in advance, places that are able to provide, appropriate application facilities and willing to, and we really feel like that's a role that our food banks can facilitate at the local level, is in identifying those potential sites and helping to establish those MOUs. I think this is something probably everyone agrees with and has talked about already, but typically the DSNAP benefit is a month, and we definitely feel like for major disasters, it should be much longer than that. Obviously, we're still seeing people now close to a year out from the disaster struggling to make ends meet as a result, and the 2 or the 3 months that were initially approved were potentially not even sufficient. So definitely having DSNAP benefits last for longer than 1 month for major disasters is a top priority for us. So moving on to the next slide, the sort of definition of who's affected and what area is eligible was an issue following Harvey. Our 5th recommendation is DSNAP should be available to people employed in the impacted area, in addition to residences of that area. Obviously, a lot of the businesses in those areas were closed, and so even if someone wasn't affected in terms of their home because they lived outside of the area but were working in that area, they lost wages as a result. And so we will be strongly advocating for DSNAP to extend to people working in areas affected by the disaster, in addition to the residency requirement. And then the 6th recommendation really relates to the particular relationship our food banks have with the state. We have, for many years now, over a decade, have had a contract with our state agency to help people apply for benefits during normal non-disaster times, or at least non-natural disaster times, and have a waiver from the government to actually do interviews in 5 major metro areas of the state. And so we will be leveraging that existing relationship for the regular SNAP program to hopefully develop a similar process for DSNAP so that our food banks can be actively engaged in helping people enroll during, following disasters with DSNAP. So moving on to the next slide, this is again similar to some recommendations already made, but clearly, we've moved forward technologically in terms of regular SNAP, and the option to apply online is where 70 to 80% of applicants apply now in Texas, and so we are recommending that online application be available for DSNAP as well. And then making evacuees and shelters a first priority for DSNAP is something that we felt like was kind of a no-brainer, but not followed in following Harvey. We had obviously most of the people from the areas evacuating to other major metro areas in Texas, including Dallas and Austin and San Antonio. We felt like that would have been a key time to connect some of those evacuees to DSNAP and potentially, reducing the wait times once they went back home at some of the overcrowded application sites. And so we'll be pushing that next time. And similarly, whether it's in the evacuee centers or afterwards, many of our food banks have call centers that they use for regular SNAP that can be used for DSNAP as well. But again, we need to be able to move to a more online or over the phone process for that and lift the in-person requirement. And then we're really also looking at sort of what happens after DSNAP ends, and obviously acknowledging that many, many people will continue to need help. And so we're going to be working with the state to figure out sort of an easy way to transition people who were qualified for DSNAP and have ongoing need to the regular SNAP program. In addition, we'll be looking at lifting work requirements for adult recipients of SNAP following the disaster, reducing verification requirements, just acknowledging that many of the challenges that people face immediately following disaster in terms of proving who they are and things like that are going to continue afterwards as they work to sort of get back into their homes and rebuild their lives. And then finally, we as food banks obviously are very involved in the distribution of surplus commodities through TFAP, and there was an emergency food box distribution program established while we were waiting for DSNAP to get set up to sort of fill in the blanks. And so we're also working to figure out kind of a more automatic process for triggering that to ensure that those household commodities are released as soon as possible. And they're reducing the lag time then between when the disaster hits and DSNAP can be set up. So I'll end there.
Great. And so we have time for just maybe one or two more questions. Okay, so this one is for Celia. Was the public aware of the role that DSNAP played in Texas and appreciate what came in?
No, I don't think so. I mean, I think, generally the public was super supportive of anything that could be done to help people. I think, it's obviously a stark difference for those of us that do advocacy for federal food programs on a regular basis, and the pushback we get from the public and politicians, et cetera, that all goes away during disaster, and people just want to help, and that's great. So I don't know that the public was distinguishing in their minds between private assistance or public assistance or DSNAP or some other form of help. So I don't think that they were aware that this program was there and it was an extension of the regular SNAP. And we've talked about how important it is to sort of do education in advance, not so much with the public, but with other stakeholders about the role of DSNAP during disasters.
Great, thank you. All right, so that about concludes our time. For further questions, they can be redirected to Ellen Vollinger, whose email is listed below. Also, just a reminder to check out the newly updated FRAC's Advocates Guide to DSNAP, the link included in the slides, and to print that out and to have that as you all are preparing for the 2018 disasters. So thanks once again to our speakers and to everyone for tuning in.
All right. On behalf of the Food Research and Action Center, I would like to thank you all for joining us today and for your participation. I would also like to thank each of our presenters for their excellent presentations today. At this point, we will ask that you complete this brief survey that will pop up on your screens in just a moment in order to help FRAC improve future webinars. FRAC certainly does appreciate any feedback that you can provide. Again, thank you very much for joining us today. We hope you all had a great afternoon.